There are different uses for Ice Blue Gel 2% depending on the brand. Some are used to treat minor aches and pains in the muscles and joints, like arthritis, backache, and sprains. Others are used to help relieve itching and skin irritation, such as from sunburn, insect bites, or minor scrapes. This gel contains menthol, which acts as a counterirritant. It works by causing the skin to feel cool and then warm. It is recommended to apply the gel to the affected area up to 4 times a day, and it's best to apply it at the first sign of pain or irritation. If you are using this medication without a prescription, make sure to carefully read and follow all instructions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. This medication is meant to be applied only on the skin. Use it on the affected area no more than 3 to 4 times a day. If you are using the cream, gel, or liquid, gently and thoroughly rub it in. Some liquid forms should be shaken before use, so make sure to check the manufacturer's information for specific directions. Let the medicine dry completely before allowing anyone else to touch the area. After applying the medication, wash your hands well unless you are using it to treat the hands. Avoid getting the medication in your eyes, nose, or mouth. If it does come into contact with those areas, rinse with plenty of water. Do not use this medication on serious burns or deep wounds, and do not bandage or tightly wrap the affected area. Doing so may increase the risk of side effects. You can loosely cover the area to protect your clothing. Avoid applying the medication right before, during, or after activities that increase skin temperature, such as bathing, swimming, or heavy exercise. Wait until your skin has cooled before applying the medication. Do not use a sunlamp/tanning bed, hot water bottle, or heating pad/device on the treated area. Always check the ingredients on the label, even if you have used the product before. The manufacturer may have changed the ingredients, and products with similar names may contain different ingredients meant for different purposes. Read the label carefully and ask your pharmacist if you have any questions. If your condition lasts for more than 7 days, gets worse, or keeps returning, inform your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience redness, warmth, or irritation at the site where you apply the gel, please consult your doctor or pharmacist. However, most people using this medication do not experience serious side effects. Stop using the gel and contact your doctor immediately if you notice blistering or swelling at the application site, or if you experience increased or unusual pain. While a severe allergic reaction to this gel is rare, seek medical help if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so if you notice any other effects, please contact your doctor or pharmacist. As for the best time to apply the gel, it is important to follow your doctor's instructions. If you have any concerns about the use of this medication, do not hesitate to seek medical advice. Before using Ice Blue Gel 2% Topical Dermatological Irritants-Counter-Irritant formulations, make sure to inform your doctor or pharmacist if you are allergic to menthol, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history before using this medication. If you are planning to have surgery, let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to use this medication only when clearly needed. Make sure to discuss the risks and benefits with your doctor. It's also unclear whether this medication passes into breast milk, so consult your doctor before breastfeeding. Remember to always follow the advice of your healthcare provider when using Ice Blue Gel 2% Topical Dermatological Irritants-Counter-Irritant formulations. When using Ice Blue Gel 2% Topical Dermatological Irritants-Counter-Irritant formulations, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may even increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products. Be sure to share this list with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Ice Blue Gel 2% for your specific needs. If this medication is ingested, it can be harmful. In case of an overdose with serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911. Otherwise, contact a poison control center for assistance. U.S. residents can reach out to their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Make sure to keep up with your regular medical appointments and any necessary lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to stay on track with your appointments to ensure you are getting the most benefit from using Ice Blue Gel 2% Topical Dermatological Irritants-Counter-Irritant Formulations. If you forget to use this product on your regular schedule, just use it as soon as you remember. If it's almost time for your next dose, then just wait and use it then. Don't take extra to make up for the missed dose. When it comes to storing Ice Blue Gel 2% Topical Dermatological Irritants-Counter-Irritant Formulations, it's important to keep it at room temperature. Different brands of this medication may have different storage needs, so it's best to check the product package for specific instructions or ask your pharmacist for guidance. Remember to keep all medications away from children and pets. And when it's time to get rid of this product, make sure to not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it's expired or no longer needed. If you're unsure about the best way to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.